Assalamu alaikum wa rahmatullahi wa barakatuh. Today I want to describe in this video the cardiovascular system, and my first entry is to differentiate between the circulatory system and the cardiovascular system. The circulatory system include this term include heart, blood vessels, as well as blood, while the cardiovascular system include only heart and the passage. And here we mean by passage the blood vessel, either artery or vein. Now in this picture or this photo, you see the location of the heart. The heart located at the thoracic cavity between the two lungs, and it's located at the mediastinum, but it's slightly shifted to the left. 2/3 of it shift to the left, but in fact it's located at the mediastinum. And the heart have a wide base equal to 9 centimeter, and in length equal to 13 centimeter from the base to the apex. And the heart have 4 chamber, and the right atrium and left atrium, and also the left and right ventricle. And also I will explain the heart wall and the valve, as well as the blood systemic valve. First we start with the heart wall. Here you see that the heart composed of 3 histological layer. The inner layer we call it endocardium, and this is the big layer and very strong layer. We call it the myocardium, and the outer layer we call it epicardium. And these layers are similar in all chambers of the wall and the atrium, as well as in the ventricle, but are here you find it is thin, while in the ventricle is thick, because the ventricle pump blood, so it need strong muscle to pump the blood to the body organs. And these layer, or all the heart, are enclosed by double sac wall. This is a sac. This is a sac enclose all the heart, and it composed of 2 layers. This one we call it the visceral layer, which is connected with the epicardium, and this is the what we call it the parietal pericardium, or the parietal layer of the pericardium. And this sac contain the pericardium fluid. So this double sac, we call it the pericardium, and it contains the pericardial fluid in the pericardial cavity. Now here we speak about the heart valve, and we have 4 valves separate between the chambers, and between the chamber and the main artery. First one, this is which separate between the left atrium and left ventricle. We call it the bicuspid valve, because it's composed of 2 cuspid. Bi mean 2, and the valve which separate between the right atrium and right ventricle, we call it a tricuspid, because it composed of 3 cuspid. Tri mean 3. And you see here that these valves look like a tent, and they are connected to the ventricle wall or the tendini. And this project, we call it the papillae. This is the papillary muscle, and this is the chordae tendini. This is thin thread-like. We call it the chordae tendini. And the other valve which separate between the ventricles and the vessels, the first one we call it the aortic valve. This is the aortic valve here, and this separate between the left ventricle and the aortic artery. This is the aortic artery, and here we have a semilunar valve, as well as the pulmonary valve, which separate between the right ventricle and the pulmonary trunk. We call it the pulmonary trunk. We call it, the pulmonary valve, which separate between the right ventricle and the pulmonary trunk, which supply the lung with blood for oxygenation. So we have two types of valve. We have tricuspid valve, and we have bicuspid valve, and also we have two semilunar valve, the aortic and the pulmonary valve. Now finally we have the systemic vessel, the main vessel that supply blood with supply the body with the blood, and it also the veins which retain back the blood to the heart. We have here, you see, this one is the aorta. When it ascends from the heart, when it rises from the base of the heart, we call it ascending aorta. And then when it arched, this arch, when it arch, we call it aortic or aortic arch. And then the aorta will descend and supply the organs in the abdomen and in the pelvic. We call it descending aorta. So we have ascending aorta, aortic arch, and descending aorta. And from the aortic arch, three main vessels rise. The first one, which supply the upper left limb, we call it left subclavian artery, which supply the left upper limb. We call it subclavian because it runs under the clavicle bone. And the second one, this supply the head and neck, and we call it the left common carotid. And this big one we call the brachiocephalus. This trunk give two branch, one of them to the right upper limb, and we call it right subclavian artery. Also it runs under the clavicle bone. And the other is the right common carotid, which supply the left main vein. The first one is the superior vena cava, which take blood from the head and neck and some of the thoracic organs. And here we have the inferior vena cava, which take blood to the heart from the lower part of the body, the organ in the lower part of the body. Also we have the aortic, the pulmonary trunk, which rise from the right ventricle and run to the lung to supply it with the blood for oxygen. Thank you very much till here.